All right, in this video, I'm gonna run you through two types of bunion surgeries. One is the Lapidus, and one is gonna be a minimally invasive bunion surgery. I'm gonna let you know what the surgery entails and really what to expect after surgery and a little bit about the surgery itself. So here we go. Here's an x-ray of the Lapidus. Essentially what we're doing is we're rotating this first metatarsal into its correct and anatomic position, nice and parallel to the second metatarsal. And we're using a variety of screws in this instance to hold that position. So this is a fusion of the first tarsal metatarsal joint. Here are the tarsal bones, here are the metatarsals. This is fused in that corrected position. After surgery, typically patients will have a small incision on the inside and they'll have an incision on the top. This patient here is about 3 weeks out after surgery. They've still got some swelling, but really the incision is healed at this point. So what can you expect after surgery? So immediately after surgery, you're gonna have to be off your foot for at least a period of 4 weeks when there are only screws present. If there's a plate on the top, I'll let people start to walk in a boot at 2 weeks. So you wake up from surgery, you're gonna be in a splint. That means there's gonna be a hard cast on the back of your leg. It's gonna be soft around the sides to allow for swelling to happen, and you're gonna have to keep that completely dry for 2 weeks. I typically will see patients back in my office somewhere between 10 and 14 days after surgery. We'll remove everything, we'll go ahead and take the stitches out, and then we'll go ahead and switch you into a boot. In the boot, you can flex your ankle up and down, you can start to move that big toe joint around, and we'll get you going with physical therapy. Now, what are the risks with having surgery? This is the type of surgery where you will have general anesthesia. Some patients will get numbing medication that I inject that lasts about 3 to 4 hours after surgery, and some patients will end up getting what's called a popliteal nerve block. If you like that popliteal nerve block, it gives you pain relief oftentimes for 18 or 24 hours after surgery, and it really helps with the post-op pain. So that is an option also. Also, there's obviously risk with anesthesia. So we get preoperative clearance from your doctor. We get some appropriate lab work to make sure you're healthy enough to undergo the procedure. Now, are there any other risks? There's risk of infection. We make sure we give you antibiotics after surgery along with your pain medication, and we talk to you about the risk of a blood clot. A blood clot can happen anytime you're not moving your ankle up and down and that blood is stagnant. You can have a risk for a blood clot. So I'll talk to you about moving your knee and moving around. Just because you can't put weight on it doesn't mean you're bedridden. So what else can you expect? You can also expect there to be some swelling. Usually up until about the 3 to 4 month mark, there is some swelling, but it certainly gets better as time progresses. So just as a recap, with the Lapidus type surgery, or that first tarsal metatarsal joint fusion, you have to be off your foot for 2 weeks if you have a plate, and if there's just screws, you have to be off your foot for 4 weeks. After that period of 4 weeks time, you'll be starting physical therapy. You'll also be able to put weight on your foot at a maximum of 4 weeks in the boot. Most people can expect to go back into regular shoes about 8 weeks after surgery, and I usually will tell people no jumping or running until at least 3 weeks out. Now, in the meantime, 8 weeks from surgery, when you switch into your shoe, you can do elliptical, you can do rowing, and you can do some biking. If you have any more questions, don't hesitate to ask, and as always, happy recovery.